Today I am going to be speaking about Ocrevus and my experience with the quick Ocrevus infusion, which is 2 hours instead of like 6 hours that the old infusion was. And I'm also going to be speaking a little bit about my post-Ocrevus experience and the post-Ocrevus experience in general, what some of the common side effects of Ocrevus are, what you should look out for within your own body, and just a little bit of the tips and tricks I've learned along the way. I have been taking Ocrevus for about 4 or 5 years currently, and so I have a lot of experience with the post-Ocrevus experience and what you feel after getting Ocrevus, and just how to basically have a healthy, happy life after going through the infusion, and how to just overcome all of what came up during the infusion. So first things first, what to expect when you get the Ocrevus infusion. This is going to depend on whether you are at the point in your Ocrevus journey where you can take the short dose or the longer dose. That is going to be determined on how you have handled the Ocrevus in the past, how your body handles it. So for some people, they have a really positive reaction to the Ocrevus infusion and they don't get a lot of side effects both during the infusion and afterwards. And so those are the people who will tend to have a sped up dose, and that can take about 2 hours. Whereas if you have some side effects during your Ocrevus infusion, they'll just slow down the dose and give it to you at a slower rate. So that's really just going to help you with the symptoms that you're experiencing during the infusion. So the quick dose, I was quite nervous going into it. I thought that it was going to be intense on the body and that I was going to have a lot of side effects. When I have the longer Ocrevus dose, so that's basically the same amount of medicine, it's just at a slower rate. When I have that longer dose, I often experience symptoms that are similar and mimic the common cold. So I get a sore, itchy, kind of constricted throat, and sometimes it's a little bit hard to breathe. Not that difficult, but it's definitely a bit uncomfortable. I also tend to experience a lot of nausea and general kind of flushing and a little bit of a swelling. It's definitely nothing crazy and nothing too intense, but it just makes you feel a little bit uncomfortable. So I thought that when I would get the short dose, the sped up dose, that it was going to be those symptoms like times 10. And so I was really nervous about that. But actually, I must say I kind of had the same sort of experience. I did not have a lot of flushing. You tend to flush from the shoulders up. I didn't personally have a lot of flushing. I did have a little bit of an itchy and constricted throat, and if that happens to you, you can just tell your nurse and they will either slow it down or give you something to help with the allergy kind of symptom. That will just help you through the dose. But for me, I didn't have really any of those experiences at a heightened level. I had very subtle feelings of constriction in my throat and chest, a little bit of flushing, but other than that, I felt really good. I did experience a lot of nausea, but nausea is very common for me. I'm someone that often can get quite nauseous, so again, it might not be everyone's experience with Ocrevus. I just lean more towards like the nausea side of the spectrum, and so I did get a little bit nauseous, and with that I would highly recommend anything ginger, so ginger ale or ginger tea. Ginger really helps with nausea. Overall, the entire process still took quite a lot of time. I got there at 8:30, and I think they started giving me the pre-medicine at 9 or 9:30, and that's the Benadryl and the tablet medication, and then you wait a little bit and then you get authorized to Ocrevus, and then you have an hour observation period. So overall I finished at 1 or 1:30, somewhere around there, and so it's still pretty much a whole day event, but it's much better than getting it for like 6 hours. And so I really did prefer the sped up dose. It just makes the whole experience a lot more pleasurable. And I said this in my last video about everything you need to know about Ocrevus, but just really make sure that you drink a lot of water before getting your infusion. If you don't, you're going to be dehydrated and they're going to struggle to find your veins. That's what happened to me. Even though I drank 1 or 2 glasses of water. It wasn't enough. And so she really struggled to find my veins, and that was really painful. So you just want to make sure that you're really hydrated, and that when you are getting your infusion, you've drunk enough water and you are warm and all the rest of it, and so that they can just find your veins easier, and that you don't have to be poked a couple of times, and because that's just going to be really sore and super uncomfortable. So back to the Ocrevus side effects. All of that was pretty much normal, common cold symptoms, a little bit of an itchy throat and a little bit of a constricted breathing, a little bit of nausea, a little bit of flushing, but nothing too crazy. So now let's go into the aftermath of getting your Ocrevus infusion, and typically what you might experience or what the typical side effects are. I'll speak for my personal experience and then speak about the more general side effects. For me, after Ocrevus, I feel very tired and very lethargic. I also feel super grumpy. Kind of like aggression, moodiness, grumpiness is actually super normal, and that is caused by the steroids that they give you. And so you're not crazy if you're feeling a little bit grumpy or a little bit aggressive. You're not crazy if you're feeling a little bit moody after your infusion. The medication does kind of mess with your natural rhythm. Afterwards, you also might experience a lot of fatigue. That's super normal, and the fatigue can last anywhere between the day right after the Ocrevus, so as you get it the day of, to 3 weeks post Ocrevus infusion. People with MS do struggle with chronic fatigue and being super tired, and so this might also just be one of your symptoms of MS. So Ocrevus might not fully help that feeling of being chronic fatigued and lethargic, because it might actually induce it. But once the medicine has worn off, you should start to feel a little bit of a difference in your energy. At least maybe you'll have some better ebbs and flows instead of just being at the chronic fatigue level. So the medication should start helping you feel a little bit more energized, even if you don't feel that way straight after the infusion. Remember that that is also caused by the Benadryl right after the infusion. You're obviously going to be tired if you've had the Benadryl during the infusion. So feeling fatigued is very normal. It's a very normal side effect, and it can last for some time. Hopefully you'll experience an improvement. Other Ocrevus side effects include a really sore body. This is one of my symptoms that I experience after I go through the Ocrevus infusion. My body feels super sore. My muscles feel like they're in a lot of pain, and it kind of feels like a little bit of a nerve pain. I feel very stiff, but not stiff like post-workout stiff. I feel sore, like I just feel sore inside myself. And so this is a very normal side effect of Ocrevus. So if you're experiencing feeling like you're in a little bit of pain, that's completely normal. I know it's not easy, but at least you know that it is a common side effect. Another common side effect are headaches. And so a lot of people post Ocrevus will have some headaches. This is also something that I experience. And so this is a common side effect of having the Ocrevus infusion. You might also continue to feel like you have a little bit of a common cold symptoms. That's also normal, but it should go away quite quickly. There's some more common side effects after the Ocrevus infusion include a cough, and like I said, that's similar to the common cold side effects. But you could also just have a cough without having a sore throat or any of those other experiences, and you can also have a cough even if you didn't experience that within the actual infusion. Another side effect is having a really sore stomach and diarrhea. That's pretty normal. I think that because the medication is so hard on the body and you're having like so many fluids pass through your system because of the infusion, it's very common to have a sore stomach and have some diarrhea. Another really common side effect, and this is something that I struggle with, is some skin infection, and this could show up as a rash or little pimples on the skin. So I always get a lot of little pimples on my face after the Ocrevus infusion. This is just because of the medication, and this is really normal, so it's not something to worry about. This can also be further induced by the steroids that they give you while having the Ocrevus infusion. So skin infection, a rash, or little pimples are actually really common side effects after getting the Ocrevus infusion, and this will happen whether you get the sped up dose or the normal dose. Another common symptom that a lot of people experience is a really stiff neck or pain in your neck, swelling in this region, or swelling anywhere on your body. This is also a common side effect. So another common side effect with the Ocrevus infusion is having some redness in your eyes or a little bit of a swelling in your eyes. So the swelling can be quite mild and the redness can be quite mild, but it can also be more towards the extreme side. So if you are experiencing any of that, just check in with your neurologist and speak about your symptoms. Another side effect, which is very common, and this is something that I experience, is a dizziness or just not feeling 100% balanced on your feet. So feeling like you have a little bit of it kind of feels like a motion sickness or just like a dizziness when you're walking, and you kind of feel like it's hard to balance. Again, this is kind of a common symptom with MS, and so if you're experiencing this as a symptom, that's also super normal, but sometimes the Ocrevus can also just induce that on its own. Yeah, when I walk after getting my Ocrevus infusion, I feel like it's really difficult for me to find my balance, and that wears off for me quite quickly. I just go for a walk when I'm finished my Ocrevus infusion, and then I start to feel like I have a lot more balance, but I definitely do feel a little bit off center for like 24 hours after the infusion. Another really common side effect can be drowsiness and confusion. So the confusion can be induced by the drowsiness, or they can exist separately. So you might be super confused and not really know what's going on for a little bit, and you also might feel really drowsy, which can be induced by just feeling general chronic fatigue and whatnot. So when it comes to the confusion, another common side effect paired with confusion can be brain fog. And so you might feel super brain foggy after getting your infusion. You might not be able to bounce back like this, and that's also completely normal. For feeling brain foggy, I highly recommend having a super healthy meal, lots of protein and lots of hydration. Drinking water throughout your Ocrevus infusion is, I think, an underrated thing that not a lot of people talk about and not a lot of healthcare providers speak about, but drinking water is really important. It helps your body not get dehydrated during the Ocrevus infusion, and also the medication is so hard on the body, and so the water to me just honestly helps me feel like I am able to get through the infusion a lot easier. I've had experiences where I haven't drank as much water versus times when I have drunk a lot of water during the infusion, and I can see a major difference in my overall side effects after the Ocrevus infusion when I drink a lot of water versus when I don't. I still get the side effects, of course, but during the entire process and afterwards, I feel like my recovery is a lot better if I drink a lot of water. And I also think that drinking a lot of water after the Ocrevus infusion really helps just kind of like minimize the side effects. So if I'm feeling very lethargic, I like to go for a brisk walk and drink a lot of water. And it just completely makes me feel so much better. I think that anyone would feel really sick after getting something that's so hard on the body, and so just drinking a lot of healthy fluids like coconut water or just general water or a rehydrate and eating some really healthy foods is going to help set you up for success and just make you feel better all around. So obviously I don't experience all of those side effects, and you might not either. You might just experience a couple of them, just like me. If you do, then that's also completely normal and completely valid. If it is something that you're worried about, speak to your neurologist, speak to your doctor, and get the help that you need. One of the things that I really encourage is to keep a journal during the Ocrevus infusion and sometime after. If you're having any symptoms that you feel are something to worry about, or even just general side effects that you're experiencing, write them down and then track them throughout your whole Ocrevus journey, because at that point you're going to start being able to properly understand how your body relates to the medication. Like I said, I've been on this medication for about 4 or 5 years now, and so I obviously have a lot of information about how my specific body reacts to the medicine. So I have a lot of information about myself, and so I'll know what's normal for me and what's not. I'll know if I should worry about something or if there's something I need to bring up to my neurologist. I think that that's really important. Understanding yourself and understanding your body and the way your body reacts to the medication, knowing what's normal and what isn't normal. And in that case, you can speak to your neurologist about something that you're worried about or something that's abnormal. Maybe you have an abnormal side effect when you've never experienced that before. So that's just something that you want to keep in mind. You want to just be super empowered when you go into this. And I think it's just really important to be empowered when you are living with a disease, because we have to take our health and our healing into our own hands. This medicine does an absolutely wonderful job, and I wouldn't be where I am today if it wasn't for Ocrevus. But I also think that I do a wonderful job at managing my health, knowing what's good for me, and also looking out for things that I can see are not working for me and not serving me. Or I also know when a side effect isn't good or isn't normal. And in that case, I can speak to my neurologist and get the help I need early on, rather than waiting, or rather than gaslighting your own experience. I think sometimes we experience something during the infusion that feels wrong or we know is wrong, but then afterwards we just push it to the side. Some time goes on and we either forget about it or think that it never happened and kind of gaslight ourselves out of that experience. But when it comes to being in control of your own health and taking your healing into your own hands, you also just need to be aware of what's going on when you're getting the infusion and aware of how you're reacting to the medication, so that you can get the help you need from your healthcare providers. I strongly recommend just being informed about what's going into your body, but also be informed about the way your body reacts to it. And so that might take you a couple of doses before you fully understand how you relate to the infusion. And so if it's your first time taking the Ocrevus infusion, I definitely don't think you should pressure yourself to know everything. Just keep a little lookout for how you're experiencing it. And then the next time you get the Ocrevus infusion, keep a little lookout. And then the more you go along, as the years go on, you'll be able to better understand how you relate to the medication, how your body relates, how you mentally relate to the medication, and that will just help you all round through the experience. So something that I would like to speak about before I finish this video, I just stopped and got myself a nice cup of tea, but something that I wanted to speak about before the end of this video is the mental health component of having a disease, as well as going through the Ocrevus infusion. And so what we need to understand is that when we get the medication, it's a physical representation, a physical manifestation, if you will, of having a disease. And so you're actually seeing it. And so when you're getting the infusion, it is showing you essentially that you have something that makes you sick, and this medication is going to destroy that thing or help you with being sick. And so it's a physical realization of the fact that you have a disease and you have a lifelong illness. And that can be super difficult. So even if you're not thinking about this on a conscious level, that stuff is still going on within you. So it's really normal for you to have all sorts of experiences. You can be anxious or depressed or sad or angry or whatever it is that you're feeling. It's important to also give as much attention to our emotional feelings as we do our physical side effects and symptoms. And so I think it's really important that you pay attention to how you're feeling. So if you're feeling sad, if you're feeling overwhelmed, if you're feeling depressed, if you're feeling anxious, if you're upset, all of these things are so important to look at and to give yourself the space to feel all of it. So don't ignore it, don't pretend it's not there. Journal about it, speak to a friend or a therapist or a loved one. Get it off your chest, and if you're not the type of person that wants to speak about it, I highly recommend, like I said earlier, to journal about it and just to get your thoughts out there so that you're not feeling them stuck within you. And it's also important to nurture yourself. After I had my Ocrevus infusion, I had a really wonderful self-care evening, and so I highly recommend pairing the Ocrevus infusion with something that's super nourishing for your mental health. So for me, that's really going all in with the self-care and getting an eye mask and relaxing, having a nice bath bomb. I like to spoil myself after I've gone through such a hard thing because I feel like it really helps my mental and emotional state. And so you need to find whatever works for you and do that so that you can assist yourself through that very, very difficult time. And there's no shame if you're having these experiences, if you're feeling sad, if you're feeling overwhelmed. It's so valid and it's so normal. So I really just want to urge you to pay attention to how you're feeling on an emotional level through the infusion and after the infusion, and to really just be so gentle with yourself. So if being gentle with yourself is going for a walk by yourself alone in nature and just shutting off from the world, then please do that. If nurturing yourself is having a bath or calling a friend or being with family, whatever makes you feel good is something that I really want you to do. And things that don't make you feel good, if you don't want to see people, if you need your loved ones to understand that after the infusion you just want to be left alone to watch Netflix or have a bath, then communicate with the people you love and ask for support and ask for them to help you. It's important that you also understand what makes you feel good and how you can ask the people around you to support you. So tune within, ask yourself what you need, and then give that to yourself. And if you need to speak to other people to get some help, to get some assistance so that you can have time alone or have time with them, be sure to speak to your loved ones and communicate your needs, understand your needs, and really listen to those. And like I said, just nurture yourself, pay as much attention to the emotional side of things as you do the physical side of things. I really hope that you enjoyed this video, and if you have any Ocrevus questions or any MS questions in general, please feel free to ask them to me and I'll be sure to get back to you. I am sending you lots of love and good luck with your Ocrevus infusion, and if you've already had it, congratulations. I hope that you're doing well, and I'll see you in the next video. Lots of love.